Hello friends. Today we're going to discuss about parent management training in conduct disorder. I'm Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about management of conduct disorder. What are the best psychosocial treatment which are available? Specifically, I'll be discussing about parent management training, what are the evidence, how to conduct this parent management training, what are the number of sessions, what are the different homework assignments given in parent management training, and finally, the critique with regard to parent management training. Conduct disorder is a common and highly impairing psychiatric disorder in children and adolescent population. It is characterized by severe antisocial and aggressive behavior. Conduct disorder is known to coexist various other psychiatric disorders. It is known to have comorbidity with ADHD, ODD, SLD, and substance use. Various studies have indicated a early onset conduct disorder can later lead to antisocial personality disorder in adult. Conduct disorder is associated with later aggressive behavior, antisocial behavior, adult criminality, recidivism, early arrest, poor physical health, early death, comorbid substance use, high risk sexual behavior, teenage pregnancy, poor academic performance, unemployment, and causing a huge cost not only on the family, society, and large at the nation level. Why is it? The person with conduct disorder not only causes burden on the health system, they also cause burden on the society through various criminal activity, adding burden to the judiciary and law enforcement agency. Conduct disorder is common in males when compared to females. The usual presentation occurs invariably in 10 to 12 years in boys, whereas in 14 to 16 in girls. Male to female ratio is 2 is to 1. That means male have more prevalence of conduct disorder. If you look at the symptoms, as per DSM 5, in the past 1 year, at least 3 symptoms should be present in the 15 listed symptoms. It is easy to remember by mnemonic bad for a business. Bad. B means bullying, A means animal cruelty, D for destroying others' property. For fighting, out late nights, running away from the home. A for actively forcing sex on others. Business, being cruel to people, using weapon, setting fire, going into someone's house, building, car, that is by breaking into that, not going to school, everyday lying, stealing, conning others, stealing while confronting a victim, stealing without confronting a victim. These are the various symptoms. Out of that, at least 3 should be there in the past 1 year. Further, it has been categorized based upon the onset. If the onset is less than 10 years, it is called as childhood onset. If it is more than 10 years, it is called as adolescent onset. If the onset is very difficult to pinpoint, then it is unspecified onset. Further, the conduct disorder has been categorized into with pro-social emotional specifier or without that. That means that child should have fulfilled the diagnostic criteria for conduct disorder and also should have at least 2 or more symptoms of pro social emotion specifier, such as lack of remorse or guilt, callous and lack of empathy, lack of concern about educational and occupational performance, and shallow emotions. If any of these two are there, then we will consider as with pro social emotional specifier. However, ICD 10 talks about the conduct disorder within the setting, whether CD is confined to family, confined to social, and finally, unsocialized conduct disorder. If you look at the prevalence of conduct disorder, 5% of the children population do have conduct disorder. Males suffer more than the female. Invariably, 15 to 20% of the children do have conduct symptoms. If you look at the prevalence of conduct disorder is commonly seen from the disadvantaged communities. If you look at the comorbidity, 70 to 80% of the conduct disorder children invariably will suffer from one more psychiatric disorder. The commonest being oppositional defiant disorder, attention deficit disorder, specific learning disorder, substance use disorder, intermittent explosive disorder, depression, anxiety disorder, and bipolar disorder. Now let's look into the assessment of conduct disorder. I index of suspicion is very essential to make the diagnosis of CD. A good clinical history, mental status examination, if required, admission and ward observation. The evaluation can be done either on OP basis or inpatient basis. Please try to get a collateral information from all possible sources such as peers, teachers, friends, relatives, from law enforcement agencies, social investigation report, social background report, report from counselors, SIBs, and parents. There are few scales available for the assessment, but the gold standard is clinical assessment. If there is family discord, please do refer them for family assessment. Before you start the assessment, please know the source of referral. Is it the parents? Is it the school? Or else is the law enforcement agency has referred for assessment? In the first contact, please do take a brief history. After that, engage the child. Talk to the child in the absence of parents. Once you come to know what is the reasons, the child's perception with regard to the current consultation, whether the child acknowledges that he has problems and he requires help. After that, talk to the parents. Ask for the reason for consultation. And finally, please do have a combined session with the parent and child. You need to ask for family assessment if there is severe marital discord is there, and then start the assessment from the recent delinquent behavior, that is the recent offense, and then move on to the past offenses and look into the pattern and do the assessment. During the assessment, keep in mind comorbidity is the rule of thumb. 70 to 80% of conduct disorder do have one more psychiatric diagnosis. Hence, you need to assess comorbidity and treat the comorbidity. Here, the medications plays a crucial role whenever the comorbidity of ADHD, substance use disorder, anxiety disorder, impulsivity, depression, mood disorder, if it is there. Look for specific learning disorder. Please do address if the child has SLD. The treatment of conduct disorder is psychosocial treatment and medication. Invariably, the psychosocial management is the first line of treatment. Medication plays a crucial role whenever there is a comorbidity. If you look at this diagram, It clearly talks about conduct disorder with internalizing symptoms, that is, anxiety, depression, PTSD, conduct disorder with externalizing symptoms, that is, ADHD and ODD, comorbid developmental disorders such as SLD, elimination disorder, and language disorder. In spite of all this comorbidity, the first line of treatment is psychosocial intervention. If the child has internalizing behavior, please do consider SSRI. If the child has ADHD and ODD, please do consider the first line of treatment as a stimulant, because stimulant not only brings down the ADHD symptoms but also hyperactivity and also violent behavior and impulsivity in children. If the child has severe violent behavior, please do consider risperidone. Invariably, psychosocial management is the first line of treatment in conduct disorder. Various textbooks and also guidelines have clearly indicated parent management training is the best line of treatment in conduct disorder. Now let's discuss about parent management training. In a recent Cochrane review done by Furlong and his colleagues in 2012, this study was published as a Cochrane Review journal, Evidence Based Child Health. The title of the study was Behavioral and Cognitive Behavioral Group Based Parenting Program for Early Onset Conduct Problems in Children Aged 3 to 12 years, a review. This Cochrane review included 13 RCTs, in which 10 RCTs and 3 quasi randomized trials. In this, the two studies also looked into economic burden evaluation of conduct disorder. This Cochrane review included 1,078 children, out of which 646 were in the intervention group, 432 in the control group. The results clearly indicated that parent training produced a statistical significant reduction in the child conduct problems, whether the assessment was done by the parents or by independently by the clinician. Further, the review also said that there was a statistical significant improvement in parental mental health, parental stress, positive parenting skills, and reduction in negative or harsh parenting practices. Moreover, the intervention demonstrated the evidence of cost effectiveness in this Cochrane review. The study clearly said when compared to waiting list, that is the control group, there was a cost of approximate $2,500 per family to bring the average child with clinical level of conduct problems into non-clinical range. That means by spending $2,500, you can reduce conduct symptoms. That means 102, $150 per session. This was the study done in 2012. That means, my dear friends, if you look at the long term impact, it is worth spending $2,500 in reducing the conduct symptoms. There was another important study done by Helander and colleagues in 2024. The title of the study was The Efficacy of Parent Management Training with or without involving the child in the treatment among children with clinical levels of disruptive behavior, a meta-analysis. In this study, after doing a thorough review and having a clear-cut inclusion and exclusion criteria, this review included 28 articles and described the quantitative data from 25 different RCTs. The study, which included 28 articles, analyzed the children from 2023 numbers. Here, the various disorders like disruptive behavior disorder, ODD, and CDs were considered. The age range was between 2 to 13 years. Studies included parental rating, clinician rating, therapist rating, and teacher rating. Results of this meta analysis clearly indicated on comparing with the waiting list, parent management training improved parental skills in handling child, parent handling of stress, and child social skills. The cost of PMT program delivery was modest when compared with the long term effect of child with conduct disorder having health impact, family impact, social impact, educational, and legal cost associated with conduct disorder. Now let's look into the parent management training session. Each session lasts for 60 to 90 minutes, and sessions are done every week or else 2 weeks once. Invariably, 12 to 18 consecutive parenting sessions have to be done. Some of the parents may require booster sessions. Either one can choose to have a family as an individual therapy, or else a group of families can be considered as a small group parent management training. However, including child or the adolescent in the parent management training is left to the child's and adolescents' compliance and motivation for therapy. If you are doing a small group parent management training, that means there may be 4 to 5 group of parents who are engaging in the PMT training. Then confidentiality rule should be described and consent should be taken. Rules of engagement, the cost, time, and if there is absence from session, what should be done, how to cover this session should be discussed. At the same time, semi structured sessions will be discussed. That is, invariably each session starts with homework, review, and homework difficulties. It is around 20 to 30 minutes. Sessions which last for 30 to 45 minutes will be invariably didactic, discussion, role play. Finally, 10 to 20 minutes is about homework assignments. What is the aim of parent management training? In this PMT, it aims to teach parents the skill of developing and implementing a systematic contingency management plan in home settings to improve the interaction between parent and the child at home, to increase the possibility that the child will show pro social behavior in the society, and finally, contingency management. What is contingency management? Here, setting the behavioral goals for pro social behavior to monitor whether the child is achieving the desired goal and wanted behavior, positive reinforcement in taking steps in the direction of reaching goals, that is wanted behavior, and penalty for undesired or asocial or antisocial behavior. And in each session, the therapist can decide how the therapy session progresses. Although these sessions are semi structured, some amount of structure is required. Invariably, the therapist may employ ventilation, supportive work, empathy, so that the parents know that they are not alone. At the same time, giving information helps them to remove the guilt from either from the mother or from the father. Didactic lecture, doing role play, especially with the parents, how to deal with the children's behavior, especially unwanted. Skills depicting through role play, teaching skills, teaching token economy so that the reinforcement of the wanted behavior and penalty for the unwanted behavior. And during the group therapy, invariably peer learning and peer support system may develop, which may be helpful in crisis management. And finally, Parent stress management is very essential in PMT. Once the session starts, that is, between 1 to 3 sessions, following objectives has to be fulfilled. The first session starts with intake session, assessment of the child, if required, assessments of the parents with regard to parenting, reinforcement pattern, communication, violence, marital discord, family history of any psychiatric disorder should be done. Finally, diagnosis of the child, plan of management should be discussed with the parents. If the child has comorbid condition, you may need to start medications. If there is severe marital discord, please do refer them for family therapy. And finally, the PMT, proper goal setting has to be done. The goal setting, invariably, it is a collaborative parent child therapist. Set a specific, measurable, achievable, relevant, and time bound goals to address the child's conduct disorder. Parents are encouraged to practice self care and stress management technique because it is not easy to deal and take care of a conduct disorder child. Removing of guilt, blaming, shaming of each parents against each other should be reduced. And we need to make sure the parent as a single unit, as a main unit, to deal with the child as a subunit. We need to make sure there is no unwanted collaboration between one child and the parent. That kind of dyad need to be broken. The primary should be the mother and father. They should form a healthy dyad in looking after the child. If there is a marital discord, invariably one of the parent will liaison with the child, and that child invariably will not improve and conduct disorder symptoms will worsen. Hence, there is an important role with regard to family therapy or marital therapy in conduct disorder. If there is a requirement of family therapy, please do refer them to another therapist. At the same time, you need to educate the parents with regard to conduct disorder. What is the neurobiology? What is the long term consequences and impact on the family, on the child, and the society as a whole? What are the available treatment? What is the available evidence with regard to PMT should be discussed. Invariably, they need to know the long term impact of conduct disorder. Hence, you also need to discuss about early intervention through PMT has a good prognosis and good outcome. We need to provide certain literature with regard to conduct disorder. If possible, online YouTube videos, books can be given to the educated parents. Then you need to give some homework assignment. You ask them to list out all good behaviors in the child, all unwanted or bad behaviors which need to be extinguished. List all the reinforcement. What does the child like? It can be verbal reinforcement, physical reinforcement, food, maybe junk food, screen time, watching mobile, going to sports, watching movie, wanting toys, ice cream, chocolate. All those reinforcement list should be done by both the parents. This is how the reward and reinforcement list has to be done. How frequently these reinforcement can be given, either on daily basis or weekly basis. If you have the list of these reinforcement and rewards in your hand, which are well documented, it can be used in the contingency management and shaping the behavior of your child. You also need to discuss about special time. This is a time which is created in a regular time in a day of a period of 15 to 30 minutes every day. One parent has to spend time with the child. If the parents, both of them, want to spend time, they need to separately spend 15 to 30 minutes with the child. Here, the parent will be giving attention to the child. This has to be an important special time in which the parent will practice observing the child, allowing the child to be independent. It can be play and it can be any things where the parent will give an undivided attention. You should not involve any siblings. And also, if both the parents want to do, they need to do separately. You need to engage the child and ask your child what you would like to play. The child may say, I would like to play XYZ. Here, one need to be very clear. The parent should be actively involved in watching the child. That means he's not going to give any kind of instructions or correcting or giving prompts. Invariably, watching television, YouTube, computer is not allowed. The parents need to get down on the floor along with the child when the child is playing. Here, you need your the parent should not get engaged in the play. However, the parent is a passive and he should make announcement describing about the child what it is doing. It may be good behavior or whatever the child is doing. When the parent is giving a undivided attention, most children really enjoy this intensive attention given by the parent. During this special time, do not ask question, do not give any instructions, or do not give any praise statement. If your child becomes misbehave, aggressive, or violent, the parent simply should turn away the attention. He should look into the different direction for the few moments. Once the child misbehavior stops, again the special attention time starts. If the child continues to become aggressive, violent, you need to stop this special time, move to the other room, telling the child, it is over now and I will meet you tomorrow with regard to special time. If the child becomes extremely violent, you can consider discipline what you are doing earlier. But please be very clear. Special time has to be done every day at specific time for specific period and the parent is very passive. This undivided attention gives the child the much required love and attention. By this, a positive behavior can be shaped. This also will increase the child's compliance and positive behavior with the parent. Invariably, the child will enjoy the parent's attention. The quality of life of both the parent and the child improves in this special time. This is how the special time charting has to be done. Name of the parent who is giving special time, what was the day, what was the time, the special time in which the child did, what was the child's activity. That needs to be documented. Now, moving to PMT 4 to 8 session, you need to start with the parent busy projects. You had given 15 to 30 minutes as a special time. Now you need to focus on parent being busy project. It can be cooking, washing, cleaning, office work, or other household chores. That means one of the parent is very busy. During that time, the child need to learn to engage himself. It can be academic activity, playing, or doing something else. Here, the child should not be bothering the parents or interrupting the child. Whenever the child is able to understand, my parents are busy, I need to do my homework or other hobby related activities. If the child is able to do, immediately start the Primac reinforcer. That means you need to give the child the sweet what it likes, or else if the child wants to play a game on a mobile, that needs to be given. This is how the parent busy project Primac reward is given. In the first column, the day, the parent busy project mentioned here, which will be discussed with the child, and the child is able to maintain that period without interrupting the parents. Yes, the child will get bonus points and it will be rewarded. Further, parents are also taught to use positive reinforcement to encourage and reinforce the desired behavior. That is, the parents need to learn about the learning principles. Further, you need to also include this grandma's rule, also called as Primax principle or principle of relative reinforcement. Here, the in the Primax principle, the low occurring behavior should be made contingent upon highly recurring behavior. For example, if the child spends more time on the mobile phone watching games or YouTube, in such a scenario, the low occurring behavior may be studies. Then the studies should be made contingent upon availability of the time on mobile phone. That means if you study for 2 hours, you will get 30 minutes to watch what you want to do on the mobile phone. Here, the focus is identifying and rewarding the appropriate behavior and increasing the likelihood of the wanted behavior and decreasing the unwanted behavior. Here, the therapist need to discuss about the learning principles, operant condition and classical conditioning. The principle of operant conditioning have a practical implication for understanding how consequences influence the behavior and can be used to promote the desired behavior or to reduce the undesirable behavior. And also, one need to introduce with regard to social learning theory. That means the parent's behavior can also have a direct impact on the child. If the parent is spending a lot of time on the mobile, do you think the child will model the parent or not? And also imitation behavior. Now you need to introduce ABC analysis. ABC stands for antecedent, behavior, and consequences. ABC analysis helps to identify the patterns and factors that contribute to the occurrence and maintenance of specific behavior. What is antecedent? Antecedents are events or circumstances that precedes a specific behavior. They are the trigger or the stimuli that sets the stage for the unwanted behavior to occur. What is the behavior? It is a specific action, behavior, or a response exhibited by the child, such as aggression, violence, defiance, lying, or other disruptive behavior. What is the consequences? The consequences of the behavior can be whatever the child wants to do. Hence, now you need to make this ABC analysis, plan in such a way that unwanted behavior decreases and wanted behavior increases through reinforcement and punishing. Example: if the child is demanding for the mobile phone in a family gathering and refuses to let go, the child's that is the antecedent. The child becomes angry, starts shouting, crying, starts name calling, it falls on the ground. That is the behavior. And now one of the family member gives the mobile phone. The consequences is that means if the child is able to behave like this and it is able to get away whatever they want, of course, the antecedent behavior and consequences repeats again and again whenever the child's unwanted behavior is reinforced by giving whatever the child wants. Here, the child needs to know only the wanted behavior are reinforced, unwanted behavior are penalized. Hence, in such a scenario, in a social situation, if the child starts becoming aggressive, demanding, you need to be very clear and do not respond. You need to tell all the other family members, friends, relatives not to respond to the child and give whatever the child wants. That is very essential. That means the child should know unwanted behavior does not yield anything. This is how the ABC tracking of the child's behavior is done on daily basis. Here you are going to talk about the antecedents, what was the behavior, and consequences. Further, you need to focus on the existing good behavior of the child. You not only want to decrease the bad behavior and unwanted behavior, you want to increase and maintain the good behavior. Hence, you need to focus on the good behavior also. And you need to reinforce this good behavior so that the child knows good behavior will be rewarded. Hence, you need to catch the child when they are doing good. For example, if the child is doing good homework or else is able to do certain hobby activities, or else if the child is listening to your request, in such a scenario, you need to reinforce the child by giving the mobile phone and telling that, yes, 2 days back, you demanded the mobile phone in a socially inappropriate way. Hence, it was not given. You have become a good boy or a good girl. That is the reason I'm going to give you a mobile phone for next 30 minutes. That means the child learns that my good behavior will be rewarded. Unwanted behavior will not be rewarded. Hence, you need to catch the child during the good behavior. You need to discuss about reinforcement and punishment with the parents. What is reinforcement? It can be positive and negative. Reinforcement improves the wanted behavior. What is punishment? It can be positive and negative. It decreases the unwanted behavior. It means reinforces is basically to increase the wanted behavior. Punishment is given to decrease the unwanted behavior. Now let's look into the positive reinforcement. It can be food, it can be appreciation, token, providing screen time for the mobile, and so forth. That means introducing something to improve certain behavior. What is negative reinforcement? Here, the removal or avoidance of aversive stimuli to increase the likelihood of behavior recurring in future. What are those negative reinforcement? When you are driving, if you don't wear the seat belt, that annoying seat belt alarm will make you to put the seat belt and that alarm is stopped. Nagging parents, if you don't clean the room, if you clean the room, the parents will not nag you. Negative remarks for not doing homework. If you do homework, everybody will appreciate. That means the reinforcement is to increase the wanted behavior. Similarly, punishment is to decrease the unwanted behavior. What is positive punishment? Spanking for disobedience, giving more homework for talking in the class, ticket for illegal parking, doing extra exercise for disobedience. They are all positive punishment. What is negative punishment? Removal of a positive or a desired stimuli to decrease the likelihood of a behavior recurring in the future. Example, a teenager breaks a rule, that is undesired behavior, and the consequences is the parents will take away the teenager's phone. That is removal of the positive stimuli. That is negative punishment, my dear friends. Here, you need to have this daily report card with regard to child's name and the date. What time the child has been given certain important activities. It may be activities of daily living. It can be the positive, good activity which the child is able to do, such as getting up at the time in the morning, yes or no, reading in the morning, afternoon, evening, and the night, writing, doing exercise, doing yoga, food at the right time. By making the taking yes or no, the child starts slowly understanding that he is getting good yes and few no's. And based upon the scores of 50 to 60% or 70 to 90% on daily basis, you can reward the child with the child what it wants. That is what is token economy, my dear friends. This is how the token economy chart is done. Here on the top, You will have the behavior which will be done on everyday basis. If they are able to do, you will be giving certain points. And also, daily record, you are going to give certain points. At the same time, for the inappropriate behavior, you will give negative marking based upon the child's number of positive marking and negative marking. You will see the total points gained every day. At the same time, the child may also spend certain points on that day. And finally, the total points on that day will be documented. And finally, for every week, the total amount can be transacted for certain materialistic need of the child. That is what is token economy, my dear friends. Further, you need to introduce timeout to the parents. Timeout is defining the unwanted behavior, such as no hitting, no shouting, no cursing, no name calling, no stealing, no breaking or destroying things. These are the list of behavior which will be recorded, which will be discussed with the child and other family members. And these rules will be written on a document and will be pasted in a prominent place in the home. It can be on the television set, or maybe wherever the child sleeps, or can it be on the refrigerator, so that everybody knows what are those unwanted behavior. Locate a place for timeout and specify the time or the duration whenever the child does unwanted behavior. Whenever the child does unwanted behavior, you are not going to give any warning. You are not going to say anything to stop commands. You will take the child and put them in the timeout room. As this timeout is done quite a number of times, the child realizes that for unwanted behavior, I will be isolated. I will not be given any attention. Over a period of time, you can add other unwanted behaviors to the list. Here, you need to clearly give the message to the child that unwanted behavior leads to isolation. This is how the timeout logs are maintained in the homework diary assignment. Further, parent management training should focus now on parental communication skills, that is, improving the interaction between the child and the parent, at the same time, improving the communication between the parents. Whenever the child has to be communicated, it needs to be communicated with emotions, appropriately, with clear and concise commands and instruction. Parents are guided on implementing consistent and appropriate consequences for unwanted behavior should be communicated to the child. There should be clear emphasis on the expectation. At the same time, if there is a bad behavior, consistently giving timeout, withdrawing, reinforcement should be done clearly, and it should be communicated to each of the family members. Same time, social skills training has to be done to the parents and also to the child, because parents are the first teachers. That means they are the role models for for the kids. The child learn by observing the parents. Child do imitate their parents. Hence, the parents should also need to have a good behavior that can be modeled by the child. Hence, the parents need to change unhealthy behaviors like spending too much of time on the mobile phone, shouting at the other members of the family, domestic violence, drug abuse, alcohol use. Those things need to be stopped completely. Hence, my dear friends, parents should limit their screen time, need to get up early, do exercise, maintain healthy life habit, washing plates, cleaning the house, maintaining the tidy of the room, If the parents are able to do this, slowly the children also will learn. And now, at the 13 to 18 session, you need to introduce taking the child outside the home. Here, once you plan outing, you need to discuss with the child so that the child should learn whatever it has learnt at home. The generalization of those skills need to happen in the social setting. Plan an activity such as going to the friend's house, maybe dinner, maybe to a party, maybe to a restaurant. Here, both the parents should be with the child. They need to plan the outing. If you are going to a restaurant, go to a isolated place in the restaurant, not in a crowded place. And go to those restaurants where the food will be served early so that the child need not wait for longer time and becoming irritable. And if you are going to your friend's house, discuss with your friend that you are going to bring the child. This is a part of the parent management training. What are the prerequisite so that the your friend knows about what the parents are planning. This is how the tracking of outside the home activities, that is basically for generalization of the skills to be done. And this can be done weekly once or twice based upon the availability of the holidays. Finally, when you are looking after a conduct disorder child, invariably the parents go through hell. Hence, they need to learn about stress management. Every day, one of the parents should learn to take break for 30 minutes. It can be alternative days or on the same day. 30 minutes, the break is taken by the mother. During that time, the father will be looking after the child, or else the father takes the break. During this break time, relaxation, meditation, yoga, exercise can be planned. And many a time, weekly once time out should be planned by the each parent. It can be 3 to 4 hours watching a movie, meeting friends, socialization, so that the stress is managed very well. This is how the stress management chart has to be done so that the parents also will learn how to take care of themselves. Once you reach 18 session, discuss about weaning and booster sessions with the parents and the child. As the sessions goes on, you can add certain activities of wanted behavior so that unwanted behavior decreases. Many a time, you may have to give special counseling session whenever there is a crisis with the child. For example, the child may be arrested for delinquent behavior. Parents may be stressed out. They want help. During this crisis, you may have to do emergency sessions. But however, those sessions need to be clearly discussed, deliberated before starting PMT. In the whole process, handholding and mentoring the parents is very essential when they are providing care for a child with conduct disorder. Now let's look into the critique of this PMT. Despite various studies clearly indicate PMT decreases conduct symptoms, invariably PMT lasts for 12 to 18 sessions. Parental dropout is very commonest. 30 to 40% do not engage in PMT because of lack of time. Many a time, only one of the parent will be attending the session. Father, because of his occupation, he may not be interested or he may not have time to undergo PMT. In spite of PMT, many children do not improve, especially adolescent, do not engage in PMT and they do not follow the instruction of the parents. That also plays a crucial role. Further, in PMT, all aggressive behaviors and impulsive behavior may be difficult to control. Many a time, once the booster session and weaning is done, aggressive behavior again may restart because inconsistency with the parenting is the rule during taking care of the child. Many a time, marital discord, that is, fight between the parents themselves, will decrease the efficacy of PMT. Hence, PMT should be planned, discussed, explained. At the same time, you need to clearly drive the message, the long term impact of conduct disorder to be told. Many a time, if there is difficulty in travel and coming to the therapy, you need to logically think about it and use technology for providing PMT sessions. To conclude, conduct disorder is there in 3 to 5% of the children. PMT focuses on teaching the parents with regard to basic behavioral concept such as positive and negative reinforcement, positive and negative punishment, and contingency management. In this digital era, you need to leverage digital technology in providing PMT sessions, engaging both the parents. And PMT is one of the effective treatment of conduct disorder at this point of time, my dear friends. Thank you very much for giving your valuable time. Stay safe.